I'm Amber Reese Young. I'm the school nurse here at Bruce Drysdale. Today I'm just going to do a quick training for all the school nurse and help things here for Bruce Drysdale. There's a PowerPoint presentation which you can watch and go through in your own time, so I'm going to buzz through this and just give you some highlights and some tidbits of information that you may need to know. The services that I provide are listed here. I'll triage illness, injuries, staff wellness, chronic disease management, and other things that you can read here. There's a quick little chart to let you know the difference between me as the school nurse and the school nurse with the school-based clinic. Those are all written, on the PowerPoint. There is some information here that we both share. We both triage health problems, provide emergency care, administer immunizations, and provide mental health screening and services. The main differences as a school nurse that I do here at Bruce Drysdale is that all my services are free. Students don't have to be signed up. I'm available for all students and all staff. I oversee the immunization program and then make sure if children have chronic health conditions that an emergency plan is offered to the parents and follow up on risk management. I operate under FERPA, which is a little bit different than HIPAA. HIPAA is what the school-based health center goes, and that's why I guess they can't share health information. If a student comes into the school-based clinic, the information and the care that they provide is confidential, whereas if a student comes into the school nurse, I can provide information on a need-to-know basis, and that's the difference between the FERPA and HIPAA. And if you have any questions about that, we can go into more detail. My school schedule, I'm still going to be at Atkinson, Clear Creek, and Bruce Drysdale this year. Once the traditional schools get started up, this is what my schedule will look like. I'll be at Bruce Drysdale on Monday afternoons, Wednesday mornings, and then I leave Friday open for whichever school needs me. As we start up here in July, you'll see me more at Bruce Drysdale, given some time and getting everything squared away. I will always have my cell phone available, though. This is on the PowerPoint as well, so if there's anything that pops up, feel free to call me. There's some online trainings that are required for staff, and those are on the T-Drive. That's the basic diabetes and bloodborne pathogens. So if there's any questions on any of those topics, please just contact me and I'll be happy to get an answer for you. Do a quick training here. Please notify me immediately if you have a student in your class that has an EpiPen or an inhaler. North Carolina general statutes say that I have to offer a health plan to the parents or guardians, and students can carry these medications at school. We need a medication form. However, there is a clause for emergency medications where, for an inhaler and an EpiPen. We can go into more detail about that when you have a student with the EpiPen or inhaler. I'll just do a quick demonstration on both of these so you'll know. An EpiPen is a device that's used, and you'll have individual one-on-one I'll speak to if you have a student in your class that may have an allergy to peanuts, maybe a bee sting allergy, and this can be a life-saving device. If you have a student that has one of these, we have a medication form, and I've signed off on it. You may have to use this in an event of an emergency, and that will be spelled out on their health plan. If that happens, you always send somebody to call 911, clear out your class, you take off the cap of this EpiPen, and you want to hold it like this. Never put your thumb on either end, just hold it like a dart. And basically this needle is so big that it will go through, even if the student has jeans on, so you don't have to worry about pulling the pants down or anything like that. Whether the student's sitting, laying on the floor, standing up, all you do is one motion into the thigh muscle, and you don't have to worry, it's a big muscle, so it's going to go into the muscle. Just stay away from the knee or way up. Hold it for 10 seconds. 1, 1,000, 2, 1,000. It'll sound like an eternity. But just hold it 10 seconds. You can massage the area, and then you've had somebody, the office or someone else, call 911. And the reason why is this medication, it will save their life, but sometimes after 30 minutes, people can have a rebound reaction, and so EMS can be here to give them a second EpiPen. And then this will be disposed of. It would have to go into a Sharps box. I don't have one available in front of the video here, but there's a red Sharps box here in the nurse office or in the clinic, and that's where you would dispose of this needle. And we'll do, like I said, some practice trainings if you have a student in your class with this. The other thing that you may see regularly is an inhaler that a student may have. Now I'll give you a little tip for instructor sheet if you have a student that has one. Lots of kids can use this on their own. You just have to watch and make sure they're doing it right. But if you have younger children, say that are in kindergarten or first graders or newly diagnosed, they may require some assistance. And oftentimes they'll have a tube, it's just a big chamber that attaches to this, making sure that the medication goes further into their lungs. And this little tips for instructor sheet will give you the details on it. Basically, you remove the cap, hold it upright, shake the inhaler. You'll have the student tilt their head back slightly and breathe out. And then they'll take a deep breath in on the count of 3. 1, 2, 3. And you'll squirt the inhaler like this. I'm not going to squirt it because it actually has medication, but you open your mouth, have them open their mouth, and then you press down. They'll breathe in the medication and try to hold their breath for 10 seconds. And I know that's really hard, especially if they're having an asthma attack and they already feel like they're smothering. Just try to keep them calm, relaxed. The longer they can keep that medicine in, the further it's going to get down into their lungs. Lots of kids, it'll say 2 puffs for their inhaler, and if that happens, just wait 1 full minute before you do the second inhaler puff. And that just makes sure it goes further into the lungs. And again, we'll practice this. You'll get an instruction sheet. I just want to give you a quick demonstration. Diabetic care plans. If a student has diabetes, we offer a health care plan. So notify, the school nurse notify me immediately if a student is diagnosed through the school year or if you find out they do have diabetes. And we'll go through a more thorough education on that. Always make sure substitute teachers are aware not only of students that have diabetes, but say if you have a child with peanut allergies, if they have asthma, any big health problems, if they have ADHD and have to go to the office for medicine, just make sure that's in your plan. Accident reports, it's a report also known as an incident report, just making sure those are filled out if there's an accident or an injury, especially if a student has to miss a half day of school or if you know that they go to the doctor or have to go to a dentist because of an injury involving their teeth or a body part. We've came up with a little bump on the head letter. If a student bumps their head, and we know, every day there's loads of bump on the heads. Sometimes it's no big deal, but it's good for the parents to monitor or whoever this child lives with at least for 24 hours just to make sure. Sometimes that little slight bump on the head can be a mild concussion. So it's just to keep them safe. If you suspect any kind of serious injury, please contact Ms. Smith, contact me, or an administrator. Don't move the student, just call them for 911. We've also the incident reports. This is the head injury report, and this is when a child has a bump on the head. You fill this form out and actually just send it home with the student. Obviously, if I'm here, send the student to me for me to assess them and make sure that they are okay. Or, you can send them to the clinic if they're signed up and they can do a quick assessment. But this is just a note that goes home to let the parents know what to watch for the 24 hours. Do a quick medication training. Students have to have permission forms filled out to have any medicine, even the cough drop. Over-the-counter medicines, a parent's signature, prescription medicines, we have to have the parent or guardian and the doctor's signature. And I always recommend as well for the over-the-counter medicines, if the parent is requesting more than the recommended dose, or if the medication is to be given longer than a week, that we get a doctor's signature as well, just to cover yourself. And always, at the bottom of the form, it has a part for the school nurse and the administrator to sign, the principal. Please make sure that we sign off on that. especially having my signature on there, you're operating under my license, and so it gives you an extra layer of protection. So just make sure that I've signed off on that, and I'll keep a copy of that med form as well. We can't accept any medicines in like Ziploc bags. They have to be in the original container. Lots of times, you know, Johnny's mom may be in a hurry and just drop off 3 pills at the office in a Ziploc bag. We have to have the original bottle with the prescription label, and just to make sure that it's this, you know, the right medication and all that. And because I'm not at the school every day, principals have to designate staff to give the medication, so that's why you're having, you know, the medication training. We just have to do it every year. Here's what the medication form looks like. Down at the bottom, this is where the school nurse signs. Parents sign here, and then for prescription meds, the doctor signs here. If you have a student that has an EpiPen or inhaler, this little box here is important. If the doctor has checked in this box, it means that the doctor has signed off on them to self-administer, and so that's something, you know, that they can carry it in their backpack. They can, you know, give themselves the inhaler or, you know, the EpiPen. I always like to speak with the student though and let them know if they do use that, let their teacher know, just in case the medication is not effective. That way we can call for help. Just want you to be familiar that there's a school board policy regarding medications. Just familiarize yourself with it. It's Board Policy 421. Let me know if your child starts or changes a medication in the school year. We may need new forms signed. And again, leaving notes about, you know, if you have a substitute in your class about kids that are on medications or such. We have to have confidentiality, and again, that's HIPAA versus FERPA. We can share this information on a need-to-know basis. Obviously, you know, a substitute would need to know about this health condition so the child can remain safe. So that is okay. If you have a medication that's a controlled substance, and you say, well, how am I going to know it's a controlled substance? The main thing is, especially the ADHD medicines, to cover yourself. And usually this happens in the office, but we just do the general training. You always want to count the medications as they're brought in with the parent or the guardian. You just document who brought the medicine in and how many tablets they brought. That way it just kind of gives an extra layer of coverage of protection and documentation. For the emergency medicines, including the inhaler, EpiPen, or if you have a diabetic, emergency medicine could even be considered their snack. You always want to take those cafeteria, recess, out on the playground, if you go on a field trip, make sure that you have those medications. There's 6 rights, you guys can read that. Documentation, you want to make sure, always use an ink pen, never a pencil, so you don't have to, you know, anybody could erase or change what you've written. Never use whiteout. If you make a mistake, you just put one line through it, ERR, and your initials, and that signifies that you made an error, but people can see, you know, what you wrote, and just make the correction just above. And this is because the medication forms are a legal document, and again, that's just another layer of protection for you. This is what the medication log looks like. You'll have one of these if you have a child in your class that has to receive medicine in the classroom. And we'll go over in more detail one-on-one about this form. But basically you want to sign up here and put your initials, and then every time the medication is given, you'll put the date, time, amount given, like 2 puffs of inhaler, and your initials. I'll just do an audit a couple times a year and you know, make sure that all the forms are, you know, filled out properly and such. If there is an incident, don't try to hide it. We're human, we make mistakes. It can happen. Any of these things are considered a medication incident. You can read these. Even forgetting to document the medication can be considered an error, so just make sure as soon as you give a medication, document it right away, and that just protects you. If you do make an error, or if there's an incident, document it, report it to Ms. Smith, report it to me, let the parents know, and as appropriate, you may have to let the healthcare provider know. Or if I'm here, or even in another school, call me and I can help determine if we need to call the doctor. This is a real important one. Medication incidents that involve giving the wrong medicine to the wrong child. I put the number here for poison control. If ever that happens, call poison control right away. Obviously, let Ms. Smith know, let me know, but call right away. This is the phone number, 1-800-222-1222. Hopefully we never ever have to use it, but that's just, and they can guide us through on what to do. And again, our primary goal is just to keep the kids safe and healthy. So I want to thank you all for everything you do, and thank you for your time. If there's any questions, just let me know. Thank you.